Imagine waking up in the middle of the night with a dull ache in your calves. Or that burning, tingling feeling in your feet when you finally sit down after standing too long. Maybe your toes feel cold even when the room is warm. And somewhere in the back of your mind, a quiet worry creeps in. Is this just aging, or is something going wrong with my circulation? I've had many patients sit across from me, usually in their 60s or 70s, looking genuinely scared but trying to brush it off with a smile. They'll say things like, "Doctor, my legs just don't feel alive anymore," or "My feet feel heavy, like they belong to someone else." And what breaks my heart is how often they've been told to ignore it, or that it's normal, or that the only solution is medication or invasive procedures down the road. Let me tell you something very important right now. Poor blood flow in the legs and feet is not just uncomfortable. It's not just about cold toes or swelling at the end of the day. Over time, reduced circulation can quietly affect your balance, your walking confidence, your muscle strength, and even your independence. It can make simple joys like going for a walk, playing with your grandkids, or standing in the kitchen to cook feel exhausting or even risky. But here's the part that almost nobody talks about. In many cases, the problem isn't that your heart is too weak. It's not that your blood is too thick, and it's not that you're too old to improve circulation. The real issue is that one key movement pattern in the body slowly shuts down as we age. When that movement disappears, blood flow to the legs and feet drops dramatically, no matter how much you walk or stretch. I still remember a patient named Robert. He was 72, retired, and walked every morning because everyone told him walking was the best thing for circulation. But his feet stayed cold. His calves cramped at night. He felt unsteady on stairs. When I asked him a few simple questions and watched how his body moved, the answer became clear within minutes. He was walking, but he wasn't activating the one movement that actually pushes blood back up from the legs to the heart. And once we fixed that, everything changed. Today, I want to share with you the same insight I've shared with thousands of patients in my career. I'm going to reveal one key movement that directly improves blood flow in your legs and feet. Not a fancy exercise. Not something that requires a gym, special equipment, or painful effort. It's a movement your body was designed to do. But most people stop doing correctly after the age of 50 or 60. If you stay with me until the end of this video, you'll understand why your legs may feel heavy, tired, or numb, even if your doctor says your tests look normal. You'll learn how this one movement acts like a natural pump for your veins, helping blood travel upward against gravity. And most importantly, you'll learn how to gently bring this movement back into your daily life in a safe, realistic way, even if you have knee pain, balance issues, or limited mobility. Now, let me be very clear. This is not about quick fixes or miracle cures. I'm not here to scare you, and I'm not here to sell you false hope. What I want to give you is understanding. Because when you understand what's really happening inside your legs, fear starts to fade. And when fear fades, the body responds better. Many seniors believe that swelling, cramps, numbness, or cold feet are simply the price of getting older. Others think that if they just walk more miles or push harder, circulation will magically improve. But the human body doesn't work that way. Blood flow depends on movement, yes, but on the right kind of movement. Without it, even daily walking can become inefficient for circulation. As a surgeon, I've seen the end stages of poor circulation. I've seen what happens when the warning signs are ignored for years. And I've also seen the incredible changes that happen when people catch it early and restore what the body has quietly lost. That's why this topic matters so deeply to me. So if you've ever felt heaviness in your legs, tight calves, restless feet at night, swelling around the ankles, or a sense that your legs just don't support you the way they used to, I want you to listen closely. There is a reason for it. And there is something you can do starting today to help your body help itself. In the next part, I'm going to explain very simply and clearly what actually controls blood flow in the legs and feet, why most people misunderstand it, and why this one movement is far more powerful than most exercises people recommend. And I promise, you won't need a medical degree to understand it. When we talk about blood flow, most people immediately think about the heart. They imagine the heart as a powerful pump, pushing blood down into the legs, and they assume that if circulation is poor, the heart must be the problem. That sounds logical, but it's only half the story. In fact, when it comes to your legs and feet, the heart can do its job perfectly, and you can still have poor circulation. Here's why. Blood has no problem traveling downhill from the heart to your feet. Gravity helps with that. The real challenge is getting blood back up from the feet and legs, all the way back to the heart. That uphill journey depends on something most people have never been taught about: the muscle pumps in your lower body. Inside your calves, ankles, and feet are deep veins with one-way valves. These valves are designed to move blood upward when certain muscles contract. Think of it like squeezing a tube of toothpaste from the bottom. When the squeeze happens correctly, blood moves up. When it doesn't, blood pools down low. Over time, that pooling leads to swelling, heaviness, aching, cramps, and that cold or numb feeling many seniors complain about. Now here's the surprising part. Walking alone is not enough if the right muscles aren't activating. I see this every day. People walk with short, shuffling steps, stiff ankles, and very little push-off through the foot. The movement looks gentle and safe, but it doesn't fully engage the calf and foot pump system. So blood goes down easily, but it struggles to come back up. This is where a major myth needs to be cleared up. Many people believe that simply moving more automatically improves circulation. But movement without proper mechanics can actually leave circulation unchanged. It's like turning on a faucet with a kinked hose. Water is flowing, but it's not reaching where it needs to go. Let me give you a real-life example. I once worked with a woman in her late 60s who stood all day at her part-time job. She assumed that being on her feet meant great circulation. But by evening, her ankles were swollen and her legs throbbed. The problem wasn't inactivity. The problem was that she stood with locked knees and barely moved her ankles. Her calf muscles weren't pumping, blood was pooling. On the other hand, I've seen patients who barely walk long distances, but they consciously restore this one key movement for a few minutes a day. Their swelling decreases. Their feet feel warmer. Night cramps improve. That's not coincidence. That's physiology working the way it was designed to. Another common misunderstanding is stretching. People stretch their calves aggressively, thinking it will open up blood vessels. Stretching can feel good, but stretching alone does not push blood upward. Circulation requires rhythmic muscle contraction and release. Without that rhythm, the valves in your veins don't get the signal to move blood. Now let's talk about the movement itself, without fully revealing it yet. This movement involves the ankle, the calf, and the sole of the foot working together. It's the same movement toddlers naturally do when they first learn to walk. It's also the movement that disappears when we sit too much, wear stiff shoes, or move cautiously due to fear of falling or pain. As we age, we subconsciously protect ourselves. We take smaller steps. We avoid lifting the heel. We avoid pushing through the toes. Over time, the calf muscles weaken, the ankle stiffens, and the foot becomes passive. When that happens, the lower body pump goes quiet. Blood starts to linger instead of flow. What's important to understand is that this is not a permanent loss. The body doesn't forget how to do this movement. It simply stops being asked to do it. And when it's gently reintroduced, even in people in their 70s and 80s, the response can be remarkable. One more myth I want to gently address is medication. Some people are told that blood thinners or circulation drugs are the only answer. Those medications can be helpful in specific conditions, but they do not replace mechanical blood flow. They don't activate muscle pumps. They don't strengthen valves. Movement does that. In a moment, I'm going to show you how this one simple, safe movement wakes up the natural pump in your legs and feet. I'll also explain why it's often safer and more effective than walking longer distances, especially if you have balance issues, knee pain, or fear of falling. Before we do that, I want you to remember this. Your legs were designed to help your heart, not just depend on it. When you restore the right movement, circulation becomes a partnership again, not a struggle. In the next part, we'll shift from understanding to action. I'll walk you through how to do this movement safely, how often to do it, what daily habits support it, what foods and hydration choices help blood flow, and the most common mistakes that accidentally shut circulation down even further. Now let's talk about what you can actually do starting today, in a way that feels safe, realistic, and respectful of your body. This is where many people expect something complicated or exhausting, but I want you to relax. The movement I'm about to describe is gentle, controlled, and surprisingly powerful when done with intention. The key movement is a slow, deliberate heel lift combined with a conscious lowering back down, not bouncing, not rushing. Just lifting the heel, feeling the calf engage, and then lowering with control. This single action turns your calf into a natural pump that pushes blood upward through those one-way valves we talked about earlier. When done correctly, it's like squeezing and releasing that toothpaste tube in exactly the right rhythm. You can do this movement standing while holding onto a chair, a countertop, or a wall. If standing feels unsafe, you can do it seated. The position matters far less than the quality of the movement. What matters is that you actually feel the calf muscle tighten as the heel rises and fully relax as the heel lowers. That tightening and relaxing is the signal your veins need. I often tell patients to imagine gently pressing the ball of the foot into the floor as the heel lifts. Not hard, not forceful, just intentional. You should feel a mild warmth or fullness in the calves after a few repetitions. That's a good sign. That's blood moving. Now here's where people sometimes go wrong. They rush, they bounce. Or they do so many repetitions that the movement turns sloppy. This isn't about quantity. 5 to 10 slow, controlled repetitions done several times a day are far more effective than 50 rushed ones. Think of it like breathing. Calm, steady, and rhythmic. Another mistake is holding the breath. Please don't do that. Gentle breathing helps circulation. Inhale as the heel lifts. Exhale as it lowers. This creates a natural rhythm between your breathing and your muscle pump, which further supports blood return to the heart. I also want to talk about daily habits that either support or sabotage this movement. Sitting for long periods is one of the biggest enemies of leg circulation. If you sit for more than 30 to 40 minutes at a time, the calf pump essentially turns off. That doesn't mean you need to avoid sitting, but it does mean you should wake the pump up regularly. Even a few heel lifts while seated can make a difference. Footwear matters more than most people realize. Very stiff shoes or thick, inflexible soles prevent the foot from bending and the heel from lifting naturally. When possible, choose shoes that allow some movement through the ankle and forefoot. You don't need minimalist shoes, but you do want flexibility. Hydration is another quiet but important factor. Blood that's even slightly dehydrated becomes thicker and harder to move. Many seniors unintentionally drink too little water because they don't feel thirsty. A simple habit of sipping water consistently throughout the day supports smoother circulation. Let's talk briefly about food, not in a restrictive way, but in a supportive one. Foods that naturally support blood vessels include leafy greens, berries, citrus fruits, olive oil, nuts, and fatty fish. These foods help keep blood vessels flexible and responsive. On the other hand, very salty, highly processed foods can encourage fluid retention and swelling in the legs. You don't need to be perfect. Just be aware. There's also a posture component that often gets overlooked. When standing, try not to lock your knees. Locked knees shut down circulation. A soft bend allows the muscles to stay active. When sitting, avoid crossing your legs for long periods. Crossing compresses veins and interrupts blood flow. One more important point: pain is not the goal. You should feel activation, maybe mild fatigue, but never sharp pain. If you have a history of severe vascular disease, recent surgery, or uncontrolled pain, this movement should be discussed with your healthcare provider. But for most people, this is one of the safest ways to support circulation. I've seen patients regain confidence simply because their legs feel more responsive again. Their feet feel warmer, their balance improves slightly. They stop dreading the end of the day. These changes don't happen overnight, but they do happen with consistency. And consistency doesn't mean hours of exercise. It means weaving this movement into daily life, while brushing your teeth, while waiting for the kettle to boil, while standing at the sink. Small moments add up. In the final part, I want to talk to you about hope, about what it means to feel connected to your body again. I'll summarize the key message, share what I've seen over decades of practice, and leave you with encouragement that you are not too old and it is not too late. I want you to take a quiet moment with me right now and really think about your legs, not with fear, not with frustration, but with compassion. These legs have carried you through decades of life. Through work, through family, through stress, through joy. And when they start to feel heavy or unresponsive, it's easy to feel like they're betraying you. But they're not. They're just asking for something they've been missing. Over the years, I've watched something very consistent happen in my patients. When circulation improves, even slightly, people change. They stand a little taller. They move with less hesitation. They trust their bodies again. And that trust is powerful. It reduces fear, and fear itself tightens muscles and restricts movement. When fear loosens, blood flows more freely. The body is deeply connected that way. This one key movement we've talked about is not a miracle, but it is a doorway. A doorway back to the natural rhythm your body was designed to have. When you lift your heel with intention and lower it with control, you're not just moving a muscle. You're sending a message to your nervous system that says, it's safe to flow, it's safe to move, it's safe to support me again. I've seen people in their 70s tell me they no longer wake up with burning feet. I've seen swelling gradually reduce. I've seen nighttime cramps fade. And perhaps most importantly, I've seen people regain a sense of agency. They stop feeling like their body is something that's breaking down beyond their control. If there's one thing I want you to remember from this entire conversation, it's this: circulation is not just about the heart, it's about partnership. Your legs and feet are meant to help blood return home. When you restore that partnership with gentle, consistent movement, the body often responds in ways that feel almost surprising. You don't need to do everything at once. You don't need to be perfect, just start noticing. Notice how your feet feel in the morning. Notice the warmth in your calves after a few heel lifts. Notice how a small habit, done with care, can shift how you feel by the end of the day. Aging does not mean surrendering comfort or confidence. It means learning smarter, kinder ways to work with your body instead of against it, and you are absolutely capable of that. If this message resonated with you, if you felt seen or understood, I invite you to gently support this channel by liking the video. It helps others who may be quietly struggling find information that could truly help them. Consider subscribing if you want more calm, honest guidance about staying mobile, steady, and independent as you age. And if you're comfortable, leave a comment and tell me how your legs and feet have been feeling lately. You're not alone in this, and your story might help someone else feel less alone too. Take care of your body. It's been taking care of you for a very long time.